Hi, good morning. I'm joined here this morning with Dr. Brandon Scharer. He is a foot and ankle surgeon at Aurora BayCare Medical Center. Thank you for joining me this morning, doctor.
Thank you.
So this morning we want to talk about ankle replacement. So when should someone come and see a doctor like yourself?
The typical candidate for an ankle replacement is someone with advanced ankle arthritis. That's an individual where their ankle joint's causing significant pain and disability, a lot of times swelling. So what happens is the cartilage in the ankle joint is worn away either from wear and tear or some type of injury. And those individuals experience a lot of disability due to that arthritis.
And so if someone is a good candidate for an ankle replacement, what can they expect?
Basically what we're doing is we're removing the arthritic joint, the damaged joint, and we're replacing it with a synthetic joint. So like in this model here, we have two metal components, one in the tibia, one in the talus, and a plastic portion in between, and the individual will have a synthetic ankle joint. At Aurora BayCare Medical Center, we do CT-guided ankle replacement, which means we have a detailed CT scan prior to surgery. The engineers make components for cutting the implant, which decreases our time in the operating room, increases our results, and patients typically do much better by having that option. Individuals usually can get back to their activities around 10 to 12 weeks, usually pain-free, usually much more range of motion than they had before. So very good option for patients with advanced ankle arthritis.
Sure, wonderful. Well, thank you for joining me this morning, doctor. If you are experiencing any pain or have some questions, you can just go online to aurorabaycare.com/ortho. Good day, Wisconsin. We'll be right back.